and ranking member, and thank you to all of you. This is a really important hearing, and I very much appreciate your courtesy as well. I have long been involved in the issues around rising prices of prescription drugs, as many of our colleagues have, and I mean, this is bottom line about life-saving medicine. It's about people's life and their health. And I would say it's hard to find something more serious than whether or not people can afford the medicine that they need. And unfortunately, we know that for decades, Americans have been paying the highest prices in the world, and which makes no sense. And when we look at three times higher as many in many countries, I mean, it's just, it makes absolutely no sense. One of the life-saving drugs we've tried to tackle, and we are tackling, is insulin, and we know that prices have tripled in the last decade, with insulin costs going up 800% more than other developed countries. So we've now put a cap on of $35 per month for someone on Medicare for insulin. Good start. The drug companies that make insulin are now appearing to move in this direction, but there is a lot more to do, Medicare negotiation and so on. My Know the Lowest Price Act, which was signed into law in 2018, banned PBMs from blocking pharmacists from telling patients how they could pay less money for a prescription if they paid out of pocket. They weren't allowed to tell people that. So that was just one of many, many bad practices. So let me get to today. PBMs have said that their purpose is to negotiate lower prices. I said when we had a group of PBMs in front of us a couple of years ago, we should call them PBNs, because they're pretty bad negotiators, if that's what they're supposed to be doing. So I would first ask Ms. Feldman, can you discuss in more detail the PBM's practices that have led Americans to pay the highest prices in the world?
Thank you. When PBMs channel patients into higher-priced drugs, then the prices rise for everyone in the system. Fair and efficient markets don't work that way. Patients should be encouraged to buy the drug with a lower sticker price. That entire system is how we end up with some of the highest prices in the world for the same drugs that other developed countries are purchasing.
Thank you very much. And Mr. Levitt, you talked about the DIR fees, which I share your great concern about, both for those independent pharmacies and so on, but also for beneficiaries. And so could you talk more about how the DIR fees harm the sickest people in the system, and could you give us more detail? I mean, we're talking about people who have cancer or other serious diseases and how they are affected by these fees.
Yes, thank you. Thank you. It is true that the sickest are the most harmed, because I will say PBMs have made the argument that when we collect all these rebates and also fees from pharmacies, we're able to lower the premium. And that is actually true. That the premium is lowered for those who never use their prescription drug card, they paid a lower premium. But for the sickest Americans, those with, for example, with cancer, when they go to the pharmacy counter, as has been stated, they pay the maximum copay, they go into the donut hole, and then they go into catastrophic coverage. All of them, anyone who's on a specialty drug. And so those patients who use their medication, they pay the most. And also, the government does. In the catastrophic coverage phase, the PBM insurance company pay the least, manufacturers and the government pay more, and so do patients. So the sickest patients are the biggest losers.
Thank you. Mr. Chairman, thank you again, Ranking Member, for holding this hearing. This is a very important piece of how we're going to really make medicine in America affordable for people. And I would just add, we as taxpayers pay for basic research that creates these drugs, which I'm happy to do, and this is an important piece of what happens, but it's public dollars. And then when we end up paying the highest prices in the world, this does not equate. This doesn't work. And I'm so glad we're tackling this.
And thanks for all your leadership on these issues, Senator Stabenow. I hope everybody picked up on the point Mr. Levitt just made to Senator Stabenow, and that is, you can do phenomenally well